So these videos are starting to generate a little bit of a buzz, which is exciting. We got a comment on our blood pressure video, which I posted up onto our practice Facebook page just to share with my own patients. And we got a comment from a physical therapist, actually, where he says, the important bit here is, I would need to see longitudinal and extensive research from multiple types of practitioners. And then at the very end, he goes on to say that DCs hold doctorates, but are not medical practitioners. And that is right. Thank God. But so this person's line of thinking really highlights the total philosophical differences between medical practice and chiropractic practice. The medical world runs on a type of reasoning called inductive logic or inductive reasoning. And what that is trying to understand big principles, big pictures by looking at bunches of little individual parts and adding those together and inducing from those, this is what the whole must look like. And these kinds of studies that he's talking about is exactly what that means. So looking at thousands, tens of thousands of people, studying their blood pressure, studying how it reacts to chiropractic care and so forth, and then drawing a conclusion from all those little bits of data. That is in contrast to how chiropractic works, which is on deductive reasoning. So we start with big principles, self-evident truths, and from that, we can then apply that to the smaller cases, the smaller instances of that particular big principle. So for example, we can say we take it as a fundamental principle, a fundamental law, that the body is designed to heal, designed to function correctly. And so we can then deduce from that if there's no interference in that process, or if we can remove any interference from that process, then among other things, that person's blood pressure ought to normalize. So it's looking at it from an entirely different perspective. Rather than this kind of reductionist thinking of the medical model, it's this more holistic, principle-based model that chiropractic runs on. That's why we don't really care that there hasn't been huge longitudinal and extensive studies on this. We see it every day in our office. We know for over a century this is how things work, and we can have faith in that because we are operating from big, self-evident truths. In fact, chiropractic has 33 principles that we take as basically the axioms, the fundamental truths of chiropractic care about the world, about health, about the human body. You can feel free to look those up. I'm sure we'll be getting into those over the months and years of doing these videos. So that's all very philosophical, but it has its everyday application as well in a more recent buzzword that's out there, evidence-based medicine. Now, evidence-based medicine is not a bad thing in and of itself at all. In fact, it can't be at the end of the day. It's an exploration, a search for truth, okay? It's science being applied, and that is always going to be a good thing. But it's how it's used that is really problematic. So research-based medicine basically says that how we're going to treat patients in our office is going to be based on all of the research that's been, all the science that's been published and peer-reviewed, and that's going to be what drives how we take care of people. And that's really in contrast to a more experience-informed kind of care that we're used to giving in chiropractic care for sure, where it's tailored to the individual, it's based on experience, it's based on these bigger principles, and not, again, on this kind of reductionist way of doing things. And that's why it becomes problematic. The evidence is good. It's good to have studies that show, in fact, we can see and measure what chiropractors are saying is true, that blood pressure goes down, for example, when you adjust someone and their nervous system is clear. But the medical world is increasingly starting to almost fetishize this idea of evidence-based medicine and saying that the research is creating a mold into which we have to cram all of our patients to fit into this mold. And that's having horrible, horrible effects on our healthcare system right now. Again, we're the sickest country on earth among all the first world countries, over-consuming pharmaceuticals, just horrible, horrible outcomes in general for our healthcare system. And it's because we're trying to cram people into these molds, among other things. What evidence-based medicine should be doing is helping to inform practitioners so that they can implement that in their experience-informed care. That's what it really ultimately has to come down to. That's what chiropractors offer. The research is good. The facts are good. They can't be bad. But we need to know how to apply them and use them right. evidence-based medicine says, here's the goalpost, and unless some procedure or idea can pass over that goalpost, we can't be using that in practice. And it's ridiculous. We use what works, and what works we know through experience, we know through universal laws, and we do know through research. Research is good. Evidence is good, but we can't continue to fetishize that and make it the gold standard that decides everything we do with a person and forget that they're a person and an individual, and different things work in different circumstances for different people in different ways. That's the bottom line. So that's the big difference. That's why this comment, didn't really shake me. I responded, I think generously to this individual. But that doesn't bother me that there's not massive longitudinal studies of tens of thousands of people over the course of decades. That doesn't necessarily get us anywhere anyway. The principles, the truths that run this world and universe and our body are what matter. And we need to understand those and apply those. Medicine is increasingly forgetting them, forgetting that God made our bodies. He made them to work right. And we just need no interference in them. We do not need chemicals and therapies to run our bodies correctly for us from the moment we're born until the moment we die. If we need to, again, as I said in the previous video, medicine's fantastic at what it's fantastic at. We got to sort this all out so that we're getting people the best possible care that we can. So this turned into a bit of a rambling rant, but I wanted to share that with you because it is so important to understand that there's this fundamental difference in philosophy between medicine and its reductionist way of seeing things and chiropractic, which works from huge, big principles of fundamental truth. Very different, which means we think about things differently, we approach things differently, and we have different concerns when it comes to this evidence-based approach to dealing with people's healthcare. So I hope this was at least interesting to you. Hopefully gets you thinking a little bit about how we're approaching our health. And if that's the case, please like this video, subscribe to our channel, share this with people so that they can get this message as well. And stay tuned because there's lots more of this coming. We'll talk to you again soon.